The PrecisionPoint Transperineal access system revolutionizes the prostate biopsy by eliminating the transrectal-induced bacteria and optimizes cancer detection. This access system allows the transperineal prostate biopsy to be performed in the office setting under local anesthesia in a time-sensitive fashion. This patented system features a unique clamping mechanism, a sliding carriage with multiple apertures, and a proprietary access needle. For over 30 years, the transrectal path has been the standard method to biopsy the prostate. Infectious complications and false negative results are of paramount concern. The PrecisionPoint Transperineal access system allows strategic transperineal sampling without the need for a bulky and expensive stepper unit, yet maintaining the speed and flexibility known by urologists currently using the transrectal approach. The PrecisionPoint is loosely clamped along the shaft of the probe. The access needle position is estimated on each side, defined by the midpoint between the anterior to posterior distance and the midpoint between the midline and lateral edge of the prostate. The optimal aperture on the carriage is then selected. The PrecisionPoint is then adjusted along the shaft of the probe and tightly clamped, allowing the stabilization bars to interface with the skin and subcutaneous tissue. The skin is prepped, and then using a 27-gauge needle, 1% lidocaine is injected into the skin and subdermal tissue. The access needle is then partially engaged into the subdermal tissue, and a 20-gauge 6-inch spinal needle is then advanced through the access needle, injecting the 1% lidocaine into the subcutaneous tissue, pelvic floor muscle, and the apical prostate. Care must be taken to avoid injecting into the dorsal vein complex and limiting the lidocaine to a weight-based dose. The access needle with carriage is then advanced, engaging the needle to a depth proximal to the pelvic floor musculature. In order to sample locations anterior or posterior from the access point, one simply pulls up or pushes down on the ultrasound probe. In addition, a tilting motion of the probe as you push or pull may optimize the biopsy needle trajectory to the shape of the prostate. When sampling the lateral prostate, rotation with a sideward push of the probe will facilitate ideal sampling of this important region. Once adequate targeting of the left prostate is complete, the PrecisionPoint access needle is disengaged and rotated to the contralateral side and re-engaged. In situations where the prostate gland measures greater than 50 grams, the urologist may have limitations, sampling both anterior and posterior regions of the prostate with one aperture selection. For these patients, one chooses an upper aperture for the anterior half of the prostate and begins with either anterior quadrant and re-engages to the contralateral quadrant. Then, using the same puncture site, the access needle is repositioned into the lower aperture of the carriage, allowing accurate sampling of the posterior half of the prostate. The PrecisionPoint Transperineal access system allows the urologist to effortlessly transition from transrectal to a transperineal access route.